Yeah, we should start every press conference that way. So we are going to obviously give an update on what's going on with COVID-19. I'm going to say some opening words and kind of give a framework for the different things that we're thinking about. Going to hand it over then to Director Bonds, and then hand it over to Rick Fontana to talk briefly about some of the testing and mask distribution with the state, and then hand it over to Dr. Tracy to talk about schools. Obviously, we're seeing around the nation just cases explode. Yesterday, Connecticut's positivity rate was almost 18%, which compared to previous positivity rates is very, very high and continues to go up. I've been on the phone with our friends over at the Yale Hospital, folks at the state, folks at Yale University, monitoring what's going on. And I think everyone is very, very concerned about the dramatic increase in cases. Hospitalizations were up 150 patients to a total of 1,113 in the state of Connecticut. That's the highest since January 13th. And of the hospitalizations in the state, 73.9% are unvaccinated. So I will say it again, please get vaccinated and get your booster to keep yourself out of the hospital. A couple of other things to note, just to underscore the severity. Yale New Haven Hospital is no longer accepting visitors because of their concern about so much COVID prevalence throughout the population. As many have seen and experienced, the testing everywhere has been overwhelmed. That's nationwide. That is at every testing site in our region as well, whether it's Yale New Haven Hospital or the federally qualified health centers or the state-operated Wren laboratory testing site at Sargent Drive. A note on the Wren laboratories, because it was one of the few sites that accepted just walk-ins or walk-ups rather than appointment only. They had like every site, an extreme demand. And yesterday at the 60 Sargent Drive site, ran out of tests and therefore did not have enough tests for the New Haven Green site in the afternoon. Of course, it's tough for people who had already scheduled appointments at that site, and I think that we all regret that we ran out of tests. But unfortunately, it's the reality of the very fluid situation we're dealing with right now, where there's just so much demand for tests because of the number of cases we're seeing, and also because people are proactively getting tested because they want to interact with each other because of the holidays. The state has secured 3 million self-tests, antigen tests. However, those tests, unfortunately, have not yet arrived in the state. The state was anticipating that they would arrive today, and unfortunately, they have not arrived, and it is unclear when those tests will arrive. And so we are standing by and in close communication with the state and ready to go once we receive those rapid tests to utilize them to help support testing in the community as well. Very grateful for our partnership with the state and understand that there's a lot of pressure everywhere to acquire tests. The city has separately acquired some tests that we'll be using to ensure continuity of government. And what I mean by that is ensuring that our essential workforce in the New Haven Public Schools, essential workforce, are able to quickly get tested so that they can get back to work to keep our community safe, keep our children in school, and make sure that we do so in a safe way. Before I talk a little bit about schools, I wanted to note that New Year's Eve is tomorrow night, and we are seeing cases skyrocket. And if people go out on New Year's Eve and interact with a lot of other people, with the numbers the way they are, you can almost guarantee you're going to get COVID. The test positivity rate, as I said, was 18%, but there are estimates that it is triple, quadruple that number because there are so many people that are doing self-testing at home that is not reported into that number. There are many, many people that are asymptomatic but contagious. And so I guarantee you one of us that's looking in on this call has COVID right now. So we need to make sure that our community is smart and you do not go out and interact with other people for New Year's Eve. And I know that people had lots of plans and I think are tired of the pandemic and want to just move on. But the reality is the likelihood of people getting COVID is very high if they go out. And so we are very, very strongly encouraging people to stay within their small family group and not interact with others. In light of that, our inauguration is on January 1st. And we have dramatically changed the format of inauguration. It will only be elected officials and a small number of essential city staff that will swear in the elected officials for inauguration, the 30 alders, myself, and one board of education member. It will be done at Hill House in the Field House, which is a very, very large facility. Just a note for the press that if you are interested in covering it, you can work with Kyle. There's one, it'll be streamed online, and there's going to be one pool photographer that will be in attendance to share that footage with you. On schools, as Dr. Tracy and I have said before, and Dr. Tracy is going to go into this in a little bit more detail, the schools will be open on Monday. We continue to follow CDC guidelines, and in some cases are even more stringent than what the CDC has kind of their baseline guidelines. We're doing a number of things to further improve what are already quite strong protocols in schools. I want to emphasize for families and guardians of children that if your child has any symptoms, do not send your child into school. It is our social contract. It is our ethical responsibility for us to keep our children home if our children have even a cough. Until that child is tested, you should keep that child home. The protocols that we're reinforcing, in addition to the tests that we are hoping to procure from the state, we have already procured N95 non-medical grade masks and are sharing a good percentage of those with the adult staff at New Haven Public Schools to use to improve their protection, because N95 masks are much safer than the typical cloth masks. We will be reinstituting our health, fire, building team inspections of the New Haven Public Schools to ensure that all the protocols are in place, that the teachers and students and staff are wearing masks and following all the proper safety protocols to make sure that we're keeping folks safe. We will be working, as I said, to ensure that staff gets testing if they are symptomatic or have a COVID exposure. And the tests that we have procured for that will be used specifically to ensure staffing is able to, if they are symptomatic and test negative, get back into the school as quickly as possible. Just looking at my notes here to see if I missed anything. Maybe I will take a break and hand it over to Director Bond to cover some additional details here.
Well, good afternoon, and I just want to reiterate some of the points that were stated. We are in the peak of this Omicron variant, and many families and individuals are being impacted by this virus. We're asking individuals to please, if you're testing positive or are symptomatic, please try to stay home. If you don't have access to a test and you're sick, try not to report to work. We ask that you do contact your doctors if you have tested positive and are experiencing symptoms that require any type of prescriptions. We are seeing a significant increase in hospitalizations. Earlier this week, I reported 138 within the hospital system. Just today, I received a notice that we have 441 now in the hospital, of which 252 are part of the New Haven residents, and unfortunately 13 are pediatric. So we are now seeing, earlier this week, I reported that we had no children hospitalized. As of this morning, we did receive report that 13 are pediatric patients.
Director Vaughn, I'm sorry to interrupt, but you're talking about in the Yale New Haven Health System, correct?
Correct.
Okay.
The Yale New Haven Hospital System within our respective county and service area. And we're still closely monitoring our vaccination rates. We're still asking individuals to get boosted. Our health department is open today until 7 p.m. Please come out. You do not need an appointment. We ask and encourage all residents to take advantage of that. And also any other providers on our website, you can see a location near you to be able to access that. As the mayor mentioned, we have activated our task force and will be doing and supporting the Board of Ed with reopening. We want to make sure that the mitigation strategies are in place within each respective school. And then we also want to encourage parents again to understand that if there's a household member that is positive, that means that your child does have a direct exposure. Please do not send them to school. We want to work together and get through this surge of variants as a community, and we want to encourage people to remain safe as we enter into this new holiday. And so with that, I'm going to turn it back over to the mayor to continue with our announcement for today.
Rick, can you give a little bit update on the N95 masks that we received and testing?
Sure. Good afternoon. As the mayor said, we have received our first shipment of N95 masks. These are essentially a non-medical grade. Again, 6,000 of them will be going directly to the teachers for the New Haven Public Schools. We will also be providing masks to those schools in New Haven that are not New Haven Public Schools. Again, there are a lot of private schools as well. They've been reaching out to us. The mask is really a foldable mask, a little bit different than we're used to seeing. So this foldable mask will really, you can use it up to 5 times. It is meant to give you, as the mayor said, it's called an N95 because it actually filters 95% of the air that goes through that mask, whereas a surgical mask doesn't give you that protection. So this offers you some good protection. The question has arisen in many occasions. What do you do after you've worn it? We recommend that you can wear these up to 5 times. That's what NIOSH actually provides as guidance. After you wear it, it's where we ask you to put it into a paper bag and just keep it in that paper bag. It comes in a cellophane package. But again, if you're in close contact with someone who has been confirmed to be positive, we would ask that you then discard it and use another one. We ask that when you're taking these on and off, that you keep your fingers out of the inside of the mask. Again, it provides you a good level of protection from COVID or from any other any other airborne contaminant that may be out there, not just COVID, but any flu as well. These are going to be readily available. That's our first shipment from the state of Connecticut. We expect a second shipment tomorrow. And then on top of that, we will be asking for additional masks for children. With regard to the test kits, we will have test kits, as the mayor had mentioned, that will be available for our critical staff. They will be here in the city tonight. And again, our goal was to make sure that, especially our first responders and those individuals that are providing first response care, our emergency 911 call takers are really essential as staff. And again, we are facing huge challenges. Our numbers are larger than we had seen during the first COVID back in March of 2020. So this is a huge challenge for us. I could tell you the test site we did do yesterday. We don't have the numbers for today, but at the Long Wharf test site at Sergeant Drive, 1,100 cars or 1,100 tests were taken. So it is very successful there. Again, we apologize again, you know, for what had transpired, having to use those tests from the green. But again, 1,100 cars, and today we're very close to 1,000 cars. So again, it's successful, it's working. Everyone is facing a challenge, whether you're a firefighter, a police officer, a paramedic, a bus driver, you know, those working in the labs to test all of this. It's all a huge challenge, but we're doing, this is all hands on. We're combating it the best we can. As I said before, we're at war with this, and it's a difficult time for all of us. But if we stick together, we're going to get through this, and we'll continue to make sure that our people receive the best that we can provide.
Thanks, Rick. Dr. Tracy, you want to talk about schools? You're on mute.
Thank you, Mayor. Good evening or good afternoon, everyone. We here in New Haven Public Schools, we are very concerned about the uptick in the virus. And we have received several emails and calls from students, parents, and staff regarding closing of schools. I need to say or reiterate that New Haven Public Schools is on schedule to open January 3rd, 2022. Now, the question may arise, so if the virus is on an uptick and we're seeing more than we have seen in the past, why are we opening schools? I need to make it clear that we cannot determine if school is closed or open right now, because we would have to get into what is called remote learning. Remote learning can only be authorized by the governor or the legislatures, as in keeping with our 180 days of school that we have as policy. We have an ample supply of masks on hand for our teachers and our students. We're keeping an eye on the staff absenteeism. We're trying to find a way of tracking that, and also transportation absences. And we will stay in contact with our board and with the city and the health department as we jointly monitor the situation from now until, I would say, until Sunday or something like that, as we monitor what is happening. We've met with some of the major unions today and try to get a sense of what staff members are conveying around this uptick in virus. And we have sent out since then a joint letter to the staff. And I'll reiterate that we're asking that our families are not to send their students to school if they are sick, if they are waiting on test results, or if they show any signs or symptoms. We are sending out another parent link to our parents to reiterate that fact. And also the same for staff. If they're sick or showing any signs or symptoms, they should not be showing up at school, or if they're waiting on test results. And we know we had a challenge with the testing, but I'm glad that the mayor and the director of health and the team, the mayor's team, they're working on ensuring that we do have some testing for our staff, which may start, Mayor, as soon as Sunday if possible. So we're waiting for that information.
Yeah, we haven't quite decided to determine whether we can do that. So
Yes.
Stay tuned on that date.
Stay tuned on that. Okay. So that's all I have to say. Thank you.
And I understand that the governor just reported a daily COVID positivity rate of over 20%. Yeah. Before we hand it over to questions for the press, does anyone else on our team have anything they need to add? Okay, questions from the press? You have to raise your hand, or you can just unmute yourself if you want.
I have a question. Rick just mentioned that the test kits are coming in tonight, or they'll be here tonight. Is there an updated plan on how those will be distributed?
Rick, just before you answer that, can you be absolutely clear about what test kits you're talking about and what test kits you're not talking about? Because there are two different tranches there.
Sure, Mayor. So the test kits that will be coming in tonight, these are not from the state of Connecticut's distribution. These are test kits that the city of New Haven was able to get in the queue quickly and get them ordered. They're likely going to be for essential staff and critical staff for the city of New Haven. That will include teachers, firefighters, police officers, 911 dispatchers, public works. So those are going to be for critical staff because they're a different type of a test. It's a COVID-19 rapid antigen test. These are, it's called Indicate, and they come they're packaged a little bit differently, so we can't put them out to the public. These come in a 25 kit. It's a 25 test kit. So we have to actually, break that kit down, and they're not something that we would bring out to the public, but immediately upon receiving the state's distribution, we will be getting those out to the public immediately. It's called INDICAID. That is the name of the test if someone wants to take a look at it, but we will have, those will be here in the city literally in the next few hours. So we'll have those readily available to start a process, but they will be for just critical staff.
There's the separate tranche is what we will be getting from the state, and every municipality in the state is very is anticipating that, but we don't have details on when that's going to arrive. I'm going to go with Seamus and then Megan.
Thank you, Mayor. And my question is for Dr. Tracy about schools and kind of concern over staffing levels. I was wondering if maybe you could touch on that a little bit more. What have you been hearing from some of the major unions? You said that you've been in contact with them. Are they worried about just, so many people, especially over the holidays? If case positivity is over 20%, and maybe they had a gathering with someone, between bus drivers, food service workers, teachers, everyone that makes schooling possible, can you talk a little bit more about concerns as it relates to that element of this?
So thank you for asking that question. There were concerns raised about whether or not we had sufficient PPE in stock, whether or not something around cleaning and also around testing for staff. Those were some of the concerns that were brought up, and that we need to probably relook at some of the protocols we have in place. So those are the concerns that were brought up. And so we came together and tried to problem solve and sent out a joint letter to the school community.
Dr. Agency, if I might add, I think that, and we've internally talked a lot about this, I think we all are anticipating staffing shortages similar to what we saw in the airline industry, similar to some of the impact we've seen with school buses prior to this huge uptick. And I think nationwide, we're anticipating in almost every sector staffing shortages because so many people are getting COVID. Our goal is to get people back into schools and every other city operation as quickly as possible. And one of the tools that we are using to do so is testing, so that we can identify if someone is symptomatic, but it is not COVID, and get them back into their role, or we can identify when they test negative after having COVID and quickly get them back into back to work. I would add that we have no intention of system-wide remote learning. However, families should be prepared for the possibility that their class may go remote, or even multiple classes, and even potentially a school may go remote if there are so many cases, or if there's a lot of staffing shortages that they need to do that. So families should be prepared to do that. However, we in no way anticipate the entire system going remote.
Right now, we're trying to gauge the level of staffing shortages. It's hard to get at this time because many people are still on vacation, but we have a mechanism where we are reaching out to principals to get an idea, and we won't have that information until about Sunday night, to be honest with you, as to what the shortages may look like.
I just follow up on testing real quick. I know that there are others to get to as well, but just quickly, obviously the PCR tests are kind of the gold standard for returning to work, either if you had a close contact or if you're coming off of the illness yourself. but obviously those are in high demand as well, as are the rapid tests. Is there any consideration from the school district that maybe a negative rapid test would be sufficient to return to work if someone's asymptomatic but just had a close contact? That's just an example, a hypothetical, but obviously those are maybe not quite as accurate as the PCR. I'm just curious, given the high demand for both kinds of testing, is there any debate over maybe changing what's required to actually come back to work after a close contact?
Mayor, would you like me to take?
Yeah, I would
Yeah.
defer that. I would defer
Yeah.
to Director Bond.
Go ahead.
That's actually a really good question. So earlier this week, we also made an announcement on the recent changes of CDC on the isolation and quarantine guidance. And part of that guidance now includes a rapid antigen test as being acceptable to be able to clear individuals. And so we have made those modifications and changes, at least for the workforce piece of it. And then as far as the children, we are working closely and anticipating to get updates on the CSDE on Addendum 5 updates in regards to isolation and quarantine guidance, but definitely working on a test and stay policy, because our goal ultimately is to ensure that everyone is safe in schools, but definitely remaining in school.
Just so I understand, if a teacher in a New Haven public school has a close contact that tests positive, they get a rapid at-home test antigen that is negative, that is sufficient for them to come back to school?
So you're asking if they already tested positive? So if they were exposed to a positive case?
Right, if they're exposed to a positive case, but their antigen rapid at-home test says negative, then they can come back according to, in line with CDC guidance.
So as long as they're in line with the CDC guidance, which is that they need to quarantine for 5 days, and then we highly recommend, as long as they're not symptomatic, they can return to work in five additional days. They must wear a mask indoors or outdoors publicly, or in the school, obviously in the school settings. And so we are following the same CDC guidance that just was issued, and we will test. Individuals will have access to a rapid antigen test if needed.
Well, thank you all very much.
James, I think you actually asked a more complicated question than I would have imagined even a couple of days ago about PCR versus antigen, because, you know, in several conversations I've had with folks at the hospital, PCR test is obviously much more accurate, but could also flag someone that may have had COVID 4 weeks ago and is able to come back to work because they are not contagious, but the PCR test may still indicate they're positive. So it's a little bit more complicated than PCR is the gold standard. And I think that's something that we're going to be struggling with as a nation to figure out exactly what the right balance is here.
Yes, and I think in that question, that certainly came up earlier in a separate meeting as we are transitioning on the utilization of the gold standard of PCR tests, which is a very highly sensitive test to detect the infectious disease, whereas the antigen test can at least be able to provide that they are not having an active disease currently. So there are definitely two distinct factors when looking at PCR and a rapid test. We are following the new CDC guidance and are transitioning to ensure that we have all available options to the public.
Thanks. Megan.
Yeah, I have a question about the tests that are coming in from the state. If they happen to come in within the next few days over the holiday weekend, are you planning to mobilize staff to distribute them immediately, or would you wait until Monday?
We're anxious to get these out. Honestly, we're taking it day by day, these types of decisions, because to mobilize, it's not a snap of the fingers. It requires a significant resources, particularly staffing resources. So it's hard for me to answer your question. My sense from conversation with the state is they're really not sure when these things are going to come in. So we'll activate as quickly as possible once we get those tests in.
Okay, thank you.
Yeah. Any other questions from folks? Any other questions from the press? Going once, going twice. All right, thanks everybody.
Stay safe.
Be in touch. Take care.